Welcome to Newsworthy Stories and our special report. We're talking about a groundbreaking AI platform that monitors your vitals 24 hours a day, and it has high tech tracking, and it's a phone all in one. We're going to talk to the co founder in just a moment, but take a look at what's happening in South Florida. For the first time in the U.S., a South Florida company called Remember 2 launching its AI platform designed to save lives with a system that monitors your vitals 24 hours a day. But that's not all. It integrates with smart devices to immediately notify family members and caregivers when something's abnormal.
We build the platform from scratch. When the platform learns your routine and your patterns, when you deviate from that, an alert will go to your loved ones to say, Jeannie is normally here at 7, it's 7:50 and she's not here. And they will you can see exactly where Jeannie is. So you'll be able to tell us GPS tracker, you'll know the location. You don't have to guess.
Corlette DeVoe, who lives in South Florida but is from the Bahamas, first launched Remember 2 in the island nation and has been generating media coverage from multiple agencies, including the Ministry of Health and the Public Hospitals Authority. Remember 2 partnering with Easter Seals and the South Florida Institute on Aging to put RM2.ai to work.
Personally, I lost 3 of my uncles because of a fall. One of them wandered outside of the house, and it took us a very long time to find him. I think this is an opportunity for us to really call out supporters, funders, and help them understand the need, not only for seniors to have that health tracking and monitoring of their vitals and medications, but also the peace of mind that something like this could bring to the caregivers, for us as providers.
Please have your mom wear this device every day so that we can provide the services. We'll monitor her vitals. We're also going to keep track of her location with this device. Why did you decide to enroll your mom in this pilot today?
She likes to wander. She was diagnosed with Alzheimer's 2 years ago. I can check it, but it'd be nice to just pop into the system.
That is correct.
Even when she's here, because I have to wait to get a call.
That's correct.
Her blood pressure's high or whatever, or her, she doesn't seem right. I could pop in.
Yes.
And just check it even when she's here and not with us because she's here.
I am here for my mother, who is 95, and she's currently over at the senior program. She has congestive heart failure, and sometimes when she stands up, her blood pressure bottoms out, so she's passed out a few times, yes.
I broke this, and then I turn around and crush every bone in this.
The most important thing for us in terms of having this relationship with Remember 2 AI is we have our Senior Companion Program where we support caregivers and obviously isolated older adults. Knowing that they're home alone and need some support, having predictive analytics really will help us to figure out how we can prevent falls, how we can prevent hospitalizations versus waiting until after they get into the hospital and come back. For us, we want to be the first response versus having to wait until after they come home.
For more information about Remember 2, go to rm2.ai or call 954-495-2677. So joining me now to talk more about this incredible AI platform is Corlette DeVoe. She is the co-founder of Remember 2 and RM2.ai. Corlette, I am so excited about this platform for so many reasons. Thank you so much, first of all, for doing it, and leading this incredible initiative. Please tell us more about Remember 2 and why people need it so greatly.
Thank you so much, Jacqueline. I appreciate the invite to be on your show. I just love everything that you're doing out there. RM2.ai is something that is going to change the way people look and think and feel about healthcare. This was designed with my mother in mind and people like my mother, and essentially anyone out there who may have a loved one that could use 24-hour continuous monitoring of their vitals. This platform is an early warning platform, and it really is meant to provide continuous monitoring of your vitals. Why is that important? Let me tell you why that's important. Because as you are sitting here, we're sitting here talking, Jacqueline, if our vitals go into the abnormal range, an automatic alert will be sent to your loved one to let them know that your vitals may be abnormal or not normal. So essentially, if your blood pressure goes out of range, or your heart rate, or your temperature, this is an indication that something may possibly be going wrong in your body, but no one can tell. Our platform will send automatic alerts to your family members that you have designated to get these alerts. So we're really out here trying to help identify potential health issues early so that we can prevent unnecessary hospital visits. So hopefully we will be able to save someone's life and reduce healthcare costs.
I, and just the idea of 24-hour vitals, we saw in the story, how that is going to impact. And you've already seen it because you actually launched RM2.ai in the Bahamas, right?
Yes, yes.
And you are from the Bahamas, and that is where your mother first fell. Can you talk a little bit more about what actually happened with your mother so that people can understand we're not just talking about the technology behind this, but there's a driving force behind this whole platform that brings everything, into a close-up picture of the need?
Yes, I can share multiple stories, and I'm sure we all can. But let me share two stories with you. First and foremost, RM2.ai was founded by Bert Fertel and myself as co-founder of this platform. Bert's concern, he is 86 years old, and his concern is the fact that one, he was falling. Two, he forgot to take his medication. He would forget his cell phone. He was becoming forgetful. So he wanted to identify a way to help seniors like himself. From my perspective, this was significant for me to be involved with because this is a personal story from my family. My mother, who was hypertensive, did not like taking her medication. She ended up having a stroke as a result of her not taking her medication. She was on the floor for hours and hours and hours. We don't know how long she was on the floor for, but we do know that when my niece went to the house, she was on the floor, she was taken to the emergency room, and fast forward, my mother died as a result of complications. There are so many stories like my mother, and we do know, Jacqueline, that the biggest healthcare expense in any country is medication non-adherence. When people do not take their medication, what does this mean? This means that when you don't take your medication on time or at all, you are at risk for something happening. They say hypertension is the silent killer. It sure is, because you may feel okay, but internally you're not okay. And so you could have a stroke like my mother, or a heart attack, or something as a result of medication non-compliance. In the United States alone, medication non-compliance costs our country $300 billion a year. That means, that's insane. That means if you don't pass away like my mother did, and you have a stroke or something as a result of your not taking the medication, the state, insurance companies, and your family members have to pay to care for you. And that adds up to about $300 billion in the United States.
Mm.
How can
Well,
we help? That's what we want to do.
well, you're definitely helping because anyone who has, been watching newsworthy stories for a while, they know the story of my mother.
Yes.
And my mother, earlier this year, only a few months ago, still in recovery, right? My mother, for whatever reason, we still don't know why she fell.
Mhm.
She didn't trip over anything. She just turned and hit the floor. But she laid there for 75 hours. Now, we have all these things in place that we would normally have in place, but nothing was working for those days or hours, I should say.
Mhm.
And the one thing that could have changed all of that is Remember To, because
Yes.
she would have fallen for sure, right? By the grace of God, she didn't break anything, but she was bruised all over her body.
Mhm.
But she would not have laid there for 75 hours. She may have laid there for an hour, she may have laid there for 2 hours, but she would not have laid there for 75 hours. And that is one thing that immediately, from my story, my mom's story, would have immediately changed had she had the device you have. Because when you fall, your device, whether you push a button or not, will send out an alert to let families know that their loved one has fallen. And I would have
Absolutely.
gotten a notification immediately, and we would have
Absolutely.
had somebody there within an hour. She would have been in
Absolutely.
the hospital. She would not have, there's so many things that your device would have protected her from. She has a different device now, right? And we're grateful for it. But your device seemed to take that further because the whole idea of being able to monitor it for 24 hours a day. And she is somebody who has, history of different, things that could make her blood pressure go up or blood pressure go down. And that is something that has to be monitored. So these are the things that we need to continue to check on and see how we can do it better. And it sounds like Remember To is doing just that.
What makes Remember To different from any other platform on the market? It is designed to be all encompassing to provide support to individuals. So, for example, we know that medication non adherence is a huge one. So, our platform is set up so that the individual will get reminders about taking the medication or even going to doctor's appointments. We also know, like your mother, Jacqueline, falls are a big deal. $80 billion a year is what it costs the United States to care for folks who have fallen. Our platform is designed to monitor and send automatic alerts when someone falls. Not only do we send automatic alerts when someone falls, but we can tell you exactly, we will share at that moment their location so you'll know exactly where they are. That is huge. Third, we have a big problem with seniors aging, and a lot of them are getting dementia. So, what does that mean? We are now extremely concerned. We are living longer, but as we live longer, we want to ensure that we have the tools in place to support the aging population. We have many seniors who have dementia who get lost. Studies show that 60% of seniors with dementia will get lost at least once in their lifetime.
Mm.
And sadly, 50% of them are going to be found either seriously injured or dead within the first 24 hours. I would say time is of the essence. So we need something that will be able to alert family members when someone deviates from their location, deviates from their behavioral patterns. That's what RM2.ai does. So if you have a loved one that you're concerned about wandering, we have geofencing as well as location monitoring so that we can alert family members in real time without getting anything. It's an automatic alert that will be sent if the senior deviates from that pattern or if the senior goes outside of their designated area. That may help save a life because that 24 hours that I just mentioned is critical. We don't want someone being in that 24-hour window and having a serious injury if we can help. We are designed to support families. We are designed to monitor vitals continuously and send automatic alerts. We're also designed to send alerts if there's a fall, if someone starts to wander off. We also are concerned about social engagement. We are social beings. Socializing is important. So we have also designed and developed our personal AI assistant companion, Remy. Remy is designed to have conversations with loved ones, with anyone for that matter. You can talk to Remy any time of the day or night. Wherever you go, Remy will go with you as long as you're wearing our device. In order for
Well,
our
I love
platform,
Remy because Remy will remind people
absolutely.
about their medication. Did you take your medication? Did you move today? Did you drink your water? Did you I love that. I mean, that's really to me, it's one thing about isolation, but it's another about this is critical. Doctor's appointments. I mean, the list
Yes.
goes on. Talk about it.
The list goes on and on. From talking to Remy and asking Remy, I will tell you a story. When we were in the Bahamas, one of the seniors that was getting onboarded with this platform decided to ask Remy, "Hey, Remy, what is diabetic retinopathy?" I was like, wow, that's a big word. And Remy was able to answer the question. So you have a question, you can ask Remy. You want to have a conversation, you can talk to Remy.
You answered a question for me because I was wondering what kind of responses does Remy have? Are they all related to, just how to use the device? That's what I was thinking. I didn't realize they could talk to Remy about whatever's on the internet, because that's what it
Anything.
sounds
They
like.
can talk to Remy about anything. They can ask Remy, hey, Remy, what's the weather outside? Yeah. Remy, what should I do today? You can ask Remy, and Remy will have conversations, and it's a two-way conversation, which is amazing, which is fantastic. And that helps with the social engagement that so many people need.
Let's talk about response, okay? So let's talk about the response that you have been getting in the Bahamas because you have been there and this is where you launched Remember to and RM2.ai because you are from the Bahamas. Can you talk about the response that they're having, and you've got the Ministry of Health and the people behind it. Talk about who's already engaged with this.
Yes, we had a huge press conference a couple of months ago in the Bahamas. The Bahamas Ministry of Health and Wellness was super supportive. They actually requested a study to be done. The study was done. It has concluded. We are now in the process of having our data scientists collate the numbers, do the analysis. The report should be out next month. And once the report is out, then the next step would be making the decision as to how to proceed with Remember To. In addition to that, I've been to a number of organizations in the Bahamas presenting Remember To. And just last week, I was on Spence Finlayson's TV show at the at the TV station in the Bahamas, and the response has been resounding. We have not just seniors, we have people who are excited about the platform, who are signing up to be a part of this early warning platform so that they can get the continuous monitoring that they need. And I will tell you that one of the things that came out of this conversation with the media in the Bahamas is the need for this platform, not just for seniors, but also for adults who have chronic diseases, as well as young adults with disabilities. I was at a teachers union um, sharing the information, and one of the mothers pulled me over and said, I need this right now for my son who has autism.
Mm.
I've had numerous people call and say, we need this right now. I personally, one of my schoolmates passed away last month. He was in his 50s and he passed away from a massive heart attack. So this is not just for seniors. This is for anyone who's concerned, wants to monitor their vitals continuously, because you don't know what's going on in your body. Your vitals are an indication that something is not right. And once you find out that something is not right, the next step is to go to your doctor to find out what is truly going on. Because even though we can provide the information, we are not doctors. We're not diagnosing. We are purely providing information, your results, to your family members so you can decide what to do. We don't make that decision for you. But setting an early alert is critically important to being proactive, to prevent certain things from happening.
Right. You know, one of the things that I like to tell people, and I think we had this chat when you were speaking at the networkation that I held, and we can deny our health and our symptoms left and right. And, you know, we know things will happen. We'll be like, oh, that's something I ate or whatever it is, or because I worked out or because it's whatever. Oh, it's because such and such, you know, stressed me out. It was just a really stressful day. And that's it. But the vitals don't lie. And that's what I think will really help save a lot of people from that denial, is that you can actually see, you know, what's happening, first of all. But there has to have also be an education, right? So how do we know what's good and what's bad? And, you know, how do we even know how to read our vitals once how do we know it's good and how do we know what's bad?
Right. You know, we're not doctors, so we can learn as much as we can. But I always encourage people, when your vitals are not normal, I encourage people to call their doctor. Do not forego calling your doctor. By no means are we here saying that you want to take the vitals and you want to analyze them for yourself and diagnose yourself. We are
Right.
saying there's something that's not normal. Please share this information with your doctor. The beauty about this platform here, Jacqueline, is not only will your family members be able to see your vitals, but if you choose, you can share your vitals with your doctor's office. Let me tell you, yesterday I spent the afternoon at my mother-in-law's bedside. She's in a skilled nursing facility right now. And we have her on this platform. The nurse was so thrilled that she would be able to see my mother-in-law's vitals
Mm.
without having to go and take them. The skilled nursing facilities and the assisted living facilities love this, because not only does it save them from having to go and take the vitals, it also reduces staff time and staff workload, because they can see exactly what's going on a dashboard, no matter where they are in the world, as long as they have internet. They can see every single person's dashboard with their vitals and their results that they can use to make decisions.
Well, to me, that's what's so beautiful about this new partnership between Easter Seals and the South Florida Institute on Aging. Can you talk about what you hope to come out of that partnership and then other ones that you would like to make? Talk, the hospitals, the health insurers. Can you give us like a big view of really who you can help and who you'd like to partner with Remember Too?
Absolutely. So, this platform is so unique that it can benefit almost everyone. We're looking for the opportunity to help hospitals. And let me tell you how we can help hospitals. Hospitals want to ensure that they have access to the vitals information in real time. If they can reduce the staff workload by having the vitals automatically pulled from a device and shown on a dashboard, that would be beneficial to them. Additionally, the patient, when they're discharged from the hospital, if they are on this wearable, they're we can now provide continuity of care so that the hospital, if they choose to see what's going on with that patient when they leave the hospital for 30 days, they can still see that information. So continuity of care is there for the hospital to be able to monitor the patient when they leave the hospital. Why is that important for the hospital? Because hospitals want to reduce their readmission rates. Hospitals want to provide the best patient care possible, and we can assist them with doing that. Senior living facilities. There are a lot of senior living facilities out there that have seniors who some live independently and some have assisted care. RM2.ai can support those facilities by providing continuous monitoring of their vitals so that the staff no longer have to take vitals every day. Two, it can now provide that protection and that support to monitor location so that if a senior with dementia wanders off, you will get an alert. That facility will get an alert in real time. We've heard so many stories of seniors getting lost. There was a very sad story last year in Miami when a senior wandered off and got lost, and they could not find that senior. The family members actually found their loved one. Their loved one was found in a closet in that facility, and they were not alive. And that's their loved one had been there for days. With our platform, we would have been able to monitor location as well as provide the location of that senior that had wandered off. So ALFs, senior facilities, this is so helpful because we can monitor falls, we can monitor location, we can provide the vitals, and we can help reduce staff workload. Remember Too is here to really help support proactive care for all of us. Proactive care, because we think the future of health is prevention, but the future of health is now.
Right. And where do you think that RM2 is going? I know where you are right now, and I know the people you're trying to connect with now, but where is this going? Who else do you need to partner with to take Remember Too even to the next step? Where and who do you need to speak with now?
We would love to speak with assisted living facilities, hospitals, insurance companies. We are starting a pilot with the Area Agency on Aging next month. These agencies provide significant support to seniors, to young adults with disabilities. Those are the people that we want in the immediate future because we want to help them today. We want to provide proactive care to help reduce the wandering risks, fall risk, monitoring of vitals. There's so many benefits here. In addition to all of this, the ability to be able to see someone's vitals from anywhere in the world is amazing.
Oh my
You
gosh.
you can
Wow.
be
I
in the
didn't even think about
Bahamas. You can be in the Bahamas right now. And if I share my dashboard with you, you can see all of my vitals, you can see all of my medication, you can essentially see my file. Now, let me just clarify this. We don't provide the information, we don't share the information. The owner of the account adds anyone that they want and gives permission to whoever they want to have access to this information. We do not. We just give the owner of the account the information, and they essentially share it with whoever they want to share it with. Because we are HIPAA compliant, we don't share that information. I just wanted to clarify that.
No, 100%. Like I said, this is probably one of the most innovative stories that I have shared this year. Um, and I think it's just going to be one of the most impactful stories. I am really excited to hear about, the results. And I know that you probably may have already received a call saying, hey, this Remember to device helped save this person's life. And I do expect to hear more of that. But those are the calls I'm definitely looking to hear. For that's what Newsworthy Stories is looking for. So
Absolutely.
as we're going forward, I want to hear those success stories because this platform would have kept my mother off the ground for 75 hours. And
Absolutely.
she's, by God's grace, still going strong. And the thing that she still wanted, right, is to be able to live independently. And she's still doing that, but with the help of caregivers, but it still allows her to live independently. And I think this device would just add one more layer of protection to her and for her and those around her, because she actually, today is her birthday. She turned
Oh,
89, which means I need to call her.
you do. Happy birthday, Mom.
Yes.
That's
Oh my gosh.
amazing. Oh, you're so
Yes, her
blessed to
friends
have
gave
your
her a
mother.
big birthday party last night. So
Yes.
but that
You know,
story is also on my Newsworthy Stories YouTube channel, and I'm sure I'll put it in the chat just so you can see it and understand what she went through. But she would not have had to go through that had she
absolutely.
had Remember to. And so, we're working on that, getting her one at some
Yes.
point.
And, Jacqueline, to your point, Remember to can be used by individuals. I know I mentioned hospitals and I mentioned assisted living facilities. One of the things that we are truly focused on is independence, helping individuals stay safe, stay connected, and live independently. Because when you're able to have your independence, your quality of life is so much better. So, for individuals who are interested in this platform, by all means, give us a call. We will get you set up. We have our sales consultants who will be able to assist in getting you signed up. So please, if you're interested, go to our website, send us your contact information, and we'll have a sales consultant reach out to you to get you set up.
Yeah.
Because every life that we save is somebody's family member that's going to be grateful. Because I would have been grateful if this was around for my mom. But at least we're able to provide this to help somebody else's. And this is a great opportunity.
100%. So I do want to say that, our hope as far as even going forward with our special report is that we hope to have on Camilla Rocha and Krisha Reed to tell us, in a couple of weeks after their clients have been using the devices, we want to do a report. We want to find out how they're using it, what's working for them. And so we're going to get an update. So keep following RM2.ai AI and Remember To, as well as Newsworthy Stories, because we're not done with this story by far. And so I just want to, I thank you so much, Corlette, for joining us again, for you and Bert, for Tell, for doing this together, coming up with this device in the first place, and helping to spread that word. I want to be a part. Newsworthy Stories wants to be a part of spreading that word. This is something that it's just mind blowing, and I'm so grateful to know you. But I do want to be a part of the solution. And the one thing I have is a platform. And I always tell people, if you have a platform, use it. Use it. And this is what I like to use the platform for. And so thank you so much, Corlette. Reach out to her, give her a call. Is there anything that you want to say that hasn't been said that you want to share before we close out?
The only thing I would say is remember, every day is a gift. Every day that we are on this earth is a gift. And part of taking advantage of that gift is ensuring that we remain healthy and live a long, fruitful life. Take the opportunity to be proactive when it comes to your health. Be proactive. Sign up with us. Be a part of our journey to help the future of health be labeled as prevention. And in order to do that, you have to sign up with Remember To. RM2.ai platform is going to help with prevention, but you have to wear the device and you have to take care of your health. Your health is all you have, and that's your wealth. And we are here to support that. Once you sign up, please share your stories with us so we can show the world what a difference RM2.ai is making out there. The future of health is prevention, and the future is now.